Hello and welcome to my channel. If you are new here, then hi, I'm Emma. I run an Instagram account called Endo with Emma, which is kind of what it says on the tin. It's all about endometriosis, PCOS and women's health. So if you've clicked on this video, it's probably because you are having a laparoscopy or you have endometriosis, or you're just nosy and want to see what it's like, which is absolutely fine. So I thought that I would vlog this experience. This is my third laparoscopy. So I had one in 2017, one in 2019 and one now in 2021. So roughly 2 years apart. A bit of a backstory. This is going to be really condensed and quick. I was misdiagnosed in 2017, told there was nothing wrong with me after a laparoscopy and that my pelvic pain was all in my head. Yeah. And then in 2019, start of 2019, I had persistent pain, lots more symptoms, and I was then correctly diagnosed. Had quite a big operation, having widespread endometriosis removed by a specialist. So yeah, that's kind of a very quick version of the story. I'm now having my third laparoscopy to hopefully remove some endo. Not sure what they're going to find. Pretty sure it's grown back or there's some adhesions there. I've experienced a bit of pain since about May time last year, and it's kind of progressively got worse. So I think now's the time to get on in there and yeah, remove it so that I can get a bit of my life back. Today is Wednesday. Tomorrow is my operation. I'm very nervous. I didn't think I would be this nervous because I've kind of gone through it so much now. But yeah, really nervous. It's the 1st of April 2021 tomorrow. So we're still very much in a lockdown. Restrictions have just started to ease, but there are no visitors allowed in the hospital. So my mum will be dropping me off at the door, and yeah, that'll be it really. So I think that's probably contributing to a lot of my nerves. I keep looking here and I know I should be looking there, but it feels really wrong to not be looking there. So I'm really sorry if that's putting you guys off. What I thought I would do is run through pre-op first. So I had my pre-op 2 weeks ago. 2 weeks to the day of the op. It lasted about 45 minutes, an hour, had some bloods taken, had an ECG, had blood pressure, went through a questionnaire. I think the reason that I have to have a few more heart checks is because I have a heart condition, so yeah, just have to have a few more checks. And yeah, it's pretty simple really. They gave me a pack, so I thought it might be helpful to some of you if I just show you what's in the pack basically. Okay, so first up you get a form. I'm not going to show you because it's got some of my details, where it just runs through the things that you need to do prior to surgery. So I thought I'd just quickly run through them if you guys are waiting for a lap and you're just not sure what to expect. So no makeup, no nail varnish, no fake tan. Everything must be kind of removed and natural for theatre. Oh God, I just feel so sorry for the people that have to see me without any fake tan or nail varnish. All jewellery has to be removed. So I actually haven't removed my second piercing I had it done in November and I haven't removed it. So I'm gonna have to remove that. Leave all valuables at home. Contact lenses will be required to be removed prior to surgery. It also talks about please shower / bath as instructed using the supplied equipment. So that's this. So I don't know if you guys have seen this before. If you've had a lap before, then you will know about the sponge. So this is just a sponge that you have to wash with the morning of. So I've just washed my hair actually. I was going to do it tomorrow, but I've got to be there at like 7 AM. So yeah, I just thought I'd wash it today. So I'm going to wash with this tomorrow, no soap or anything like that. Items to be brought into surgery with you. So I'm going to run through what's in my hospital bag in a minute. That will be the next clip you see. But I will just quickly run through the list. So they say medication in original boxes, slippers, toiletries, nightwear, comfortable, loose fitting clothes. Yes, you want some big trousers. Your stomach will be really sore and swollen. And then it just says about the food. So last time I can have food is midnight tonight. and the last time I can have water is at 6 a.m. and then it's nil by mouth. So what I will probably do, I think I have to take my medication in the morning, so I will probably set my alarm for 6 and have my last water then. Next up, we just have a form that says, will I need a blood transfusion? Well, I sincerely hope not, but really good to have this information to hand if you're someone that likes reading through that. Then we've got a couple of leaflets. So we have a guide to patient consent. I hope you can see that there. Then we've got preventing urinary tract infections, so UTIs, especially after the surgery. Oh, okay, so it's got check the colour of your urine on the back. It's got a little chart. Mine's definitely like number 4 or 5. That's pretty bad. So then we've got DVTs and pulmonary embolism, so preventing DVT. You guys will probably know about this, having the stockings. So those are the leaflets. Then we've got a load more paperwork. So we have COVID-19, a hospital and operation guide, reducing your risk of developing a blood clot, so DVTs, MRSA. I didn't have swab for that. So normally at pre-op, I would do a swab for MRSA, and I didn't this time, which is strange, but yeah, maybe I'll read that and find out why. Pain relief after surgery and general anaesthetic. So it basically has on the back serious complications, stuff like that. Now, if you're somebody that does not really want to know that stuff, I'd advise not reading it. They have to write everything down. I'm somebody that loves medical stuff and finds it fascinating, so I've read it many times. But even I'm quite frightened, I think, because I know all the things that can go wrong. So yeah, I wouldn't advise doing that if that's something that would make you anxious. So that's all the pre-op stuff. I had my COVID test on Monday and I've been self-isolating ever since, working from home. Hence why, by the way, I'm sat on the floor. I'm doing this in between teaching. So next up, I am going to show you what I'm packing in my hospital bag. So first up for things to take in your hospital bag. Now, I don't know if I'm going to take this. This is a V-shaped pillow, like this. Oh, I feel like a cloud. Yeah, this is a V-shaped pillow. I love this. I only recently got it actually, but it's really helpful. I don't know if you guys can see. It's really helpful to hold around here when you're getting up and things like that. I use this primarily for the car journey there and the car journey back. Also, I think potentially if you're in the hospital bed, it might be quite useful to have it if you don't want to kind of get more pillows and stuff like that. So I might just take it with me. It feels like a bit of a comfort as well. Food and drink. It's probably worth me mentioning at this time that I'm going private. I am really, really lucky to have private health insurance. So yeah, I'm going private for this operation. So it is a slightly different experience than an NHS hospital. But hopefully you still get the rough idea of what it's like. So I will probably get a menu when I go in with what I will order. It's a bit difficult to order food before an operation because you don't know how you're going to feel afterwards. Last time I ordered a tuna sandwich and ice cream. I think I just panicked and ticked a box. And then when I came out of surgery, I came out a lot later than I thought because it was a longer op. So I think I came out at like 5 to this tuna sandwich and ice cream that had been sitting there. And then I felt like I was going to throw it all back up. So yeah, probably stick with some toast or something. But you can take food and drink with you. So I am taking ginger nuts. I don't actually like these. These are for nausea. So I find that ginger nuts really, really help with nausea. So I've got these in case I'm feeling really sick afterwards. Peppermint tea. So I've just got this Paca one. Other brands are available. Now the reason I've got these is they come in little sachets, so I'm just going to stick a few in my bag. I'm sure that the hospital will have peppermint tea or peppermint oil, but I just want to make sure I've got it because this is really good for getting rid of the shoulder tip pain that you get after they blow you up in surgery. that sounds really weird, blow you up. That's not a medical term. They fill your stomach up with air and you get referred shoulder tip pain, whereas pressing on your diaphragm. So this really helps get rid of that. And lastly, on kind of the food and drink, I've got some mints. Yeah, sometimes it can just feel a bit gross when you wake up from surgery, and if you're not ready to get up and clean your teeth, then this is quite a good shout. So yeah, I've just got some mints. I have also got my mum to go and grab me some like fizzy orange. I find that kind of having something fizzy really helps with that shoulder tip pain again, and with a bit of the bloating. And also it's quite nice to have something with some flavour, because you'll be drinking a lot of water. So yeah, would advise doing that too. Okay, next up to put in your bag is some moisturiser. You find that because you can't put any moisturiser on after the shower, I've got quite dry skin. So after you have been not drinking water for a while and been in the operating theatre, that you find you have quite dry skin. So I like to put a really nice luxury moisturiser on. So I've got some Molten Brown here. And I use this after the op as well when I'm recovering at home. It just makes me feel a bit more myself. So yeah, that's a really good shout. Hair scrunchies, so I've just got 2 that I've popped in my bag. These are really good, obviously just to keep your hair out the way. So if you're going NHS, definitely take headphones. If you're on a ward, it could be really difficult to sleep, and you want to try and make sure you've got some headphones. And also you can't obviously put your iPad or iPhone on loud, because you'll disturb other people. I'm really lucky that I think I will be having a private room, but I've brought them anyway. And I've brought my iPad, I've downloaded a couple of films. I probably won't get time, because I think that I will come out the same day, because I think I'm first on the morning list. So yeah, I doubt I'll have time to watch them, but I just thought if I do stay in, or if they're delayed for whatever reason, I want to keep myself really distracted so that I don't spiral. So again, it seems pretty obvious, some big knickers and some pads. Nothing is TMI on this channel. Let's face it, we're talking about women's health and we're talking about gynecology. So here are my Bridget Jones pants that I'm showing everyone on the internet. God, they look bigger when they're on a screen. Yeah, so big knickers, preferably a dark colour, and some pads. So I would absolutely say this is a must. You need to bring your own pads, because the hospital ones resemble a child's nappy. Yeah, you don't want to be wearing them, so you want to be really comfortable. So make sure you've got some pads. Sometimes after surgery, I know on my last one, I just woke up with like a pad placed in between my legs with no underwear. So I just left there with this pad. So yeah, you just kind of want to sort yourself out after surgery. And I've got a book. So again, a bit like the iPad, it's good to have a bit of a distraction. I might take my crocheting. I love crocheting, and it's really good to have something to do to take your mind off stuff. So I've got my book. This one's actually a medical book. This is A Junior Doctor's Story of Compassion and Burnout. So it's probably not the best book for me to be reading pre-op, but last time I read This Is Gonna Hurt, Adam Kay, which is all about gynae patients. So whatever floats your boat, I guess. And lastly, my inflatable crown to remind them that I'm a queen. I'm completely joking. I'm just trying to make light of a situation that I'm so anxious about. Oh, pajamas. So trackies. So I'm wearing these right now. Oh my gosh, you just see my feet. Loose fitting pajamas. They say to take a dressing gown. I don't know if I will. It's quite warm in the UK at the moment, so I just don't know if I will. I don't know. I'll figure it out. So yeah, operations tomorrow. Like I said, I'm really nervous. I think where I've had so much medical gaslighting and where I was misdiagnosed, it was really awful and like quite a traumatic time. And I'm just so nervous that they're gonna go in and find nothing. And then it's almost like my pain is all in my head again. And it's so stupid, because I know that I have endometriosis. I know I have widespread endometriosis over pretty much all my pelvic organs. So yeah. It's ridiculous that you get to a point where you're thinking, I hope that there is endo there, instead of, I hope there's nothing there. I think if you've got endo, or if you've got a chronic illness, then I think you'd understand it. it's really difficult. It's really difficult to explain, but I think you just want your pain validated and fixed, like ultimately. And I want to be really clear here, surgery is not a cure for endometriosis. Hysterectomy isn't a cure for endometriosis. Pregnancy isn't a cure for endometriosis. There is no cure for endometriosis. All of those things though can be used as a form of treatment to help. For me, surgery really helped. It was a long recovery. My second surgery where I had treatment, I had wide excision. So that was a lot better in my opinion than ablation. And after that, it took me about 8 months to recover. It wasn't, so I had it 1st of April, same date. How random, same date as this year. So 2 years to the day. And I... So I think I can take my mask off in the room, but yeah, I'm talking really quietly. I'm not confident doing this, but I've just got changed. I'm shaking so much, you can see how much I'm shaking. So nervous. I've spoken to the anaesthetist. He's the same one that did it 2 years ago, so I'm really happy. And he's gonna give me a spinal block, I think, which is amazing. Yeah, just waiting for my surgeon. So nervous. Hello. So this is not the most flattering angle, but I've just seen my surgeon. He's come in, got me to sign some forms. I'm so nervous, I can't stop shaking. I've just done that and I'm second on the list. So I think I'm going down about 9:30, which is in half an hour. I've got my stockings on. I have been told that by the anaesthetist that I've got the same anaesthetist as last time, and hopefully he's going to do a spinal block to help me with the pain. So I've got this, let me show you. This nappy to wear for after. So that's thrilling, I've never had that before. This is the worst bit, the waiting. Once you get this done, you'll be fine. So yeah, I'll speak to you guys when I'm out. Ooh. Hi guys, hopefully you can hear me. I've got a fan on in my room and I was sweating and yeah, struggling with like a kind of a fever. I think my temp was up. I just had some food, was a little bit poorly after the pasta. I was feeling a bit sick, so definitely order something plain. And I'm just having some water and my ginger nuts, which are really getting me through. The nurses have just given me some cocodamol as well because the pain is quite sore. So I've just seen my amazing surgeon. You can see all the wind. I look like I'm in a L'Oreal advert. I'm obviously being very sarcastic, I don't. He said that everything kind of explains the symptoms and the pain that I've gone through the last couple of months. So basically my right ovary was completely stuck to, I think, my uterus and pelvic side wall. I'm not entirely sure, like he was very vague. And I had a little bit of endometriosis behind that. I asked what area and he was just vague. He was like, oh, it's behind all of this and blah, blah, blah. Plus I was a little bit out of it as well. But he's freed up the ovaries, so he's cut all the adhesions away, and he's excised and cut all the endometriosis away behind that as well. So that should really help. And then I've got an appointment with him in 4 weeks' time to discuss it a bit further, which should be really good, because then I'll get more of a clear idea. But he was just, I appreciated him coming and telling me, but obviously he was just quite vague. At the moment, my shoulder tip pain is coming through, let me tell you. I just keep rolling it. As soon as I get home, I can have my hot water bottle. I don't think they allow you to do them here. But the bed's helping, being able to put myself up and down. This is such an unattractive angle, but I couldn't find anywhere else. And my right ovary hurts, like in the area where my right ovary would be really hurts, which makes sense because that's where most of the work was done. Incisions are so neat, they're just done with glue, there's no stitches, which is incredible. So I think I can shower. Yeah, on the whole, guys, like really positive experience so far. I feel really good, and I think I can go home today because I was so early on the morning list. Had a couple of issues with blood pressure and heart rate, which is to be expected with my stuff. Yeah, all in all, just feel so happy that it's over and done with, and yeah, just feel really blessed, really blessed that I'm able to have private medical insurance. It's just, yeah, a real blessing. But I'm gonna go and watch something on my iPad now, maybe do another little snooze, wait for the cocodamol to kick in, and then hopefully my mum can pick me up in a bit. So yeah, fingers crossed. Hopefully you can hear me in my mask. It's now 7:25, 7:30, and I've just called my mum to come and get me. I'm feeling really good. My pain management, oh my god, look at this. My pain is really well under control with codeine. So yeah, I've just had some dinner and just gonna keep drinking lots of water and head home. It is 11:10. My shoulder tip pain is horrific. Like horrific, I could cry. It feels like someone's come and dislocated both your shoulders. I'm not even going to sugarcoat it because I feel like I needed someone to be really real with me when I was watching stuff for this, and it is horrendous. So I've got a heat pack on, I've got my V-shaped cushion. This is not a cute look for me right now. Good morning, everyone. It is, oh, it's not the morning. It's 12:25. I've just woken up again. I have eaten so many of these ginger nuts, they are unreal. I actually now really like them. Only thing I can stomach, really. But I've now eaten too many, and now the pressure is building on my diaphragm. Shoulder tip pain is the worst. I woke up quite a few times in the middle of the night having to take painkillers. I stupidly didn't take painkillers last night because I thought I was feeling fine. Worst decision I've made. Please, 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 if you're going through this, just take the painkillers on time, because once it hits you, it's really hard to get it under control. But yeah, I'm feeling okay. I never thought I'd be on the internet showing my face like this. But yeah, I'm feeling okay. I'm just gonna rest, even though I feel good. I feel like I could get up and do stuff, but I'm gonna try and really rest. I think that's important for today, and drink lots of fluids. Hi guys, it's been a while since I've spoken to you. I've just been sleeping and snoozing and resting, listening to my body, drinking lots of water. It's Saturday today, so I'm 2 days post-op. I'm feeling good. I've been able to have a shower today. My blood pressure feels, well, it is low. My POTS that I suffer with, postural orthostatic tachycardia syndrome, causes my blood pressure to come down and my heart rate to go up. So I'm having to take a bit more medication just to combat that. So the main kind of symptoms I'm having at the moment is kidney pain, really bad kidney pain. I get quite bad kidney pain with ovulation and twice a month. They don't really know why, and my surgeon said that they can't visualise my kidneys properly. They can look at my ureters but not the kidneys, so that's probably something more for urology. I've had kidney stones before, and again they don't know why I get them. A couple of people have mentioned that I might have endometriosis on the outside of my kidney, so yeah, that's quite painful, but apart from that, incisions look amazing. They're really small. Honestly, not as bad as you think it's going to be. I think I've already said that in this vlog, but it's not as bad as you think it's going to be. It's totally doable. I feel like if you suffer with endometriosis already, you will find that it's actually worse having an endometriosis flare up than it is having the surgery. Surgery is kind of a piece of cake if you've been dealing with the pain for however many years leading up to it. So yeah, feeling okay, not really much to report, feeling probably how most people would feel 2 days post-op. I will try and vlog a bit more and catch up with you guys over the next couple of days. I just am finding it really difficult to find the motivation at the moment, but yeah, just really hope that this video is helping some of you. Hi guys, so today is Tuesday the 6th of April. So I think I am 5 days post-op, and this will probably be my last kind of vlog update. I've gone back to work today, working from home. I'm really lucky that I'm able to do kind of FaceTime and Zoom work, and yeah, I feel better for putting a bit of makeup on. And yeah, just feeling okay. I'm definitely a lot more tired than I expected. I only talked for kind of 2 hours and I'm shattered. But I think that's normal, recovering from a surgery. My incisions look really good. I have twinged something in my right side. I stupidly was drying my hair yesterday and yeah, twinged something. So I'm hoping that that will just die down. Yeah, I just really hope that this vlog has been helpful. I'm going to put up a updated one after my post-op. So I'm going to do like a 4-week, 6-week update. So that will be coming in like 4 weeks after I've spoken to my consultant and actually found out what they've done. Let me know in the comments box below or DM me on Instagram if there's something that you think is missing from this video or some information that you would want to know, and I can add that in the next video for you. I'm debating whether to show the pictures from my surgery because I think you will have taken pictures. I find them fascinating, but I know that some people might find them a bit gruesome. So let me know in the comments box below what you would like to see, if you would want to see them. I'll put a trigger warning before because no one needs to be seeing that if they're eating their breakfast. Do you know what? It's been fine recovery. Definitely feeling a bit low mentally. I think that's so normal after an anaesthetic, getting those anaesthetic blues. Just feel a bit kind of, yeah, low, a bit lonely. I think with COVID and everything, I can't have any visitors. But all in all, the recovery is fine and, you know, totally doable. And I think I've said before, if you've had endometriosis, it's no worse than a flare-up. So yeah, so I hope this has been helpful. I'm going to shut up now. I think it's probably like a 30-minute long vlog, but please do follow my Instagram for any more updates on endometriosis, PCOS, women's health. We have an amazing community over there, so come and join us. Yeah, we're all very open. There's nothing that's too TMI. So yeah, thank you so much for watching. Bye.